Hello, my name is Dr. Linda Isaacs. The material in this video is designed to augment what's available on my website, so please visit that site to learn more about what it is that I do. My website address is www.drlindai.com. Again, www.drlindai.com. When I first heard about coffee enemas, I thought it was one of the strangest things that had ever come my way. But they were an important part of the protocol that our predecessor in this work, Dr. Kelly, had put together. He had been using coffee enemas for many, many years as he treated patients with cancer and other types of problems, and he thought they were extremely important. Now, Dr. Kelly did not invent coffee enemas either. As it turns out, they were in the medical literature for many, many years. In fact, I've found references going back 150 years to the use of coffee enemas. In 1896, one of the Mayo brothers that started the Mayo Clinic gave a lecture in which he emphasized the importance of coffee enemas in postoperative care. And in 1941, a surgeon in Uruguay wrote a paper in which he passionately argued for the importance of coffee enemas because he had seen them work wonders in the treatments of patients with all sorts of conditions such as poisoning or postoperative shock. But coffee enemas fell out of favor as pharmacology came into favor in the 1950s. A lot of these types of techniques were put aside bit by bit without anybody ever really testing them to say whether they were effective or not. They were just simply dismissed as old-fashioned when we have all these new wonderful medications. Having said that, Dr. Kelly had tried them out when he was trying to figure out how to manage the symptoms that were coming along when he was using enzymes to treat his own cancer. So he used them, he found they helped, they made him feel better. That was enough for him. And that's enough for the vast majority of patients that come through our office. They find that they just feel better when they do them. In terms of how do they work, most likely by stimulating bile flow from the liver. The way that that can work, bear in mind the coffee enemas just go up a little distance into the colon, but the caffeine and other things in the coffee can get absorbed across the wall of the intestine and get into what's called the portal blood system. That blood system goes straight up to the liver where it can have an effect, and coffee can stimulate bile flow. Bile is where the liver gets rid of waste materials, and so presumably the coffee enemas are working by stimulating the liver to more effectively process waste. That's what we believe. Now, sometimes people wonder, are coffee enemas safe? Well, certainly I would not suggest that you embark upon this without talking to a physician first. But for most patients, as long as they don't have any major issues with their colon, such as colitis, for example, they'll probably be just fine with them. There are a few articles in the literature suggesting that coffee enemas are unsafe, causing infections or electrolyte problems, but the patients that are described in those articles had a lot of other illnesses as well. And they were so sick that the problems that are described may very well not have been due to the coffee enemas. Our own practical experience is that the coffee enemas are not dehydrating. In fact, they seem to be hydrating. If somebody is a little dehydrated, their body will just absorb some of the liquid from the coffee. As far as electrolyte issues go, the electrolyte absorption that happens in the colon happens about 4 feet upstream, a long distance away from where the coffee enemas are doing their work. So our practical experience also has been that the coffee enemas don't cause electrolyte issues. So the coffee enemas, we believe, are crucially important, perfectly safe, as long as, again, someone doesn't have any major structural or irritation issues with the colon. And for most of our patients, believe it or not, it becomes their favorite part of the program. No one ever believes this when they first come in, but that's what I hear over and over from the patients.